Recording. So welcome to Talking Data Equity for Friday, March 3rd, I believe it is. My name is Heather Kraus, and I'm the founder of We All Count, which is an organization that focuses on equity in quantitative data. And my favorite thing to do each week is talking data equity with all of you on Fridays. And this is an informal, innovative, positively oriented gathering for anybody who is working on aligning the way that they work with data with their equity goals. In other words, thinking about the human consequences of mathematical decisions. And some weeks we get together and talk about a topic. And for example, we're doing that next week. Next week, we're going to be talking about the pros and cons of using gaps in looking at outcomes and looking at other ways to think about and communicate about disparities that are not gaps. But today we have I'm very excited to say that we have a special guest that several of you asked for on a topic that many of you asked for, which is how do we collect data? How do we sample? How do we respectfully get information that can help us generate evidence about hard to reach populations? So we have Dr. Lisa Avery with us today. And I didn't check with you, Dr. Avery, but I think you're coming to us from Toronto today.
I'm actually just north of Toronto. Yeah.
Oh, okay. So just outside of Toronto. And Dr. Avery is professor at the Dalla Lana School of Public Health, which is part of the University of Toronto, where I live. It's a very well-respected school doing a lot of innovative work. And rather than taking up any more of Dr. Avery's time, I'm going to turn it over to Dr. Avery. And just a quick reminder of the housekeeping. Dr. Avery is going to talk to us for a while and present with some slides. If you have questions during the presentation, feel free to put them in the chat. And you can use the chat menu set to everyone, or you can direct message me. And put your questions in the chat at the beginning, and then we're going to do our best to have some space for some live Q&A at the very end, where if you want to unmute yourself and ask your question, we will have that set up for you. All right, take it away, Dr. Avery.
Hi, thanks so much, Heather. If any of you in future reach out to me about respondent driven sampling, you can please just refer to me as Lisa. I'm not a huge fan of honorifics. So I'm going to talk about respondent driven sampling and how. So it's a bit technical. I've tried to sort of give you a whirlwind tour. So hopefully I can cover a lot of details here in I've lost my mouse. I went to click on, we were just talking about.
It's all right. Don't worry. It happens on the reg. It will come back. No concern.
Very briefly, I was originally an engineer by training, and then I did my...
Got to interrupt you for a second, Lisa. Okay, good. Okay. Hold on one second, because I think we lost you. And then I think when you came back, we hadn't quite synced up. So what we can see right now on the screen is an About Me slide. So
okay, great.
Go from there. Fabulous. Right. Thanks, Lisa.
So I did my training originally in engineering physics. And while I was doing that, I started doing statistics. So I decided I should probably get some training in statistics. And I did a master's when I lived in New Zealand. And then I worked for several years as an independent statistician, mostly pediatric research, outcome measurement, longitudinal stuff. And then when I started my doctoral work, that's when I got involved in respondent driven sampling and have been involved in a couple of projects in Toronto. One is called Our Health Counts. It's about measuring health in urban Indigenous populations. And another one is the Empower study that's looking at experiences of personal support workers in the Toronto area. Currently, I'm a principal biostatistician at the University Health Network, and an assistant prof in biostatistics at Dalai Lama. So just a bit about me. So today I'll talk about the motivation for why you might want to do respondent-driven sampling, some features of respondent-driven sampling, and in particular, some statistical aspects, network characteristics, and hopefully motivate you to understand why this might be better than simple convenience sampling. So probability sampling is the gold standard. So this is what Stats Canada uses when they develop statistics for us. They census us every 5 years, and then they randomly select people from the census, or they randomly select areas. And they do that from what we call a sampling framework. So in order to randomly sample or to conduct probability sampling, you need to understand who the population is. So Stats Canada does that through a census, and that enables them to randomly sample from us. But what do you do if you don't have that sampling framework? And so most of probably what you are all doing involves difficult to reach populations that have no sampling framework. So we don't have a list, for example, of all the migrant workers living in Toronto. We don't have a list of all the personal support workers living in the United States. If we want to measure disease incidence in intravenous drug users, that's difficult. How do we know who all those people are? Respondent-driven sampling, it doesn't need to necessarily be about measuring marginalized populations. It has been used to sample from jazz musicians. So it's just about trying to objectively sample from populations for who we have no sampling framework. So for who we don't have a list of everybody in the underlying target population. So there are a few options for sampling from these groups. So the most popular would be convenient sampling. And that is where you just sort of put up flyers or put word of mouth around, and whoever comes through the door or sends you an email forms part of your sample. Snowball sampling is similar. The difference would be that you would recruit a few people and then ask them to go get their friends and bring them into the sample. And the sample would just snowball. You'd get more and more people in each wave. Quota sampling this is just sort of variation on the theme. So you would just continue sampling everybody you could until you hit your desired target size. Time location sampling is a little bit different. So there you choose a location frequented by the population that you want to measure from. And at various times you conduct sampling, and it's a little bit more systematic, certainly than a convenient sample. The main drawback, and time location sampling is used by, for instance, the CDC when they do their they have several HIV surveillance surveys, and time location sampling is used in one of those. I guess from my point of view, the biggest drawback for the time location sampling would be that it completely excludes all members of the population who don't frequent that venue. And so hopefully respondent-driven sampling can sometimes get around that. So respondent-driven sampling is used by the CDC in another one of their HIV behavioral surveillance surveys. So I think it's actually, I know it's used for the heterosexuals at high risk stream are sampled with respondent-driven sampling. So what is respondent-driven sampling? It's basically snowball sampling. It's sort of, I like to think of it as snowball sampling plus. So in snowball sampling, you collect some seeds from your target population. And these seeds usually represent a fairly broad spectrum of the population you want to study from. In snowball sampling, you send those seeds out to recruit their friends and so on and so on. And each wave of recruitment generally grows in size. The extra components of respondent-driven sampling are that often the participants are rewarded monetarily, both for participating in the survey, so for filling out whatever survey you've designed, but also for recruiting additional members of the target population. So that's one difference. Another difference is that in this sampling, we have these recruitment chains. So if these people are seeds and then they go off and recruit their friends and their friends recruit their friends, in respondent-driven sampling, we have to track these links. So we trace the recruitment chain to find out who recruited who. And lastly, we collect information about network degree. So network degree just simply refers to how many other people in the target population each person is connected to. So I'll talk about that a little bit more. But essentially, respondent-driven sampling is just snowball sampling where we collect a little bit more data. And then at the completion, we also use special statistical methods to help us analyze the data. So I'll go through it in just a little bit more detail. You collect some seeds. That number is usually by default around 10. There's not a particularly good reason for 10 seeds, but that's the most often chosen number. And if recruitment stalls, it's not uncommon to have to recruit more seeds. You survey those seeds, you provide them coupons, and it's those coupons that are used to recruit the next wave, but also to trace the recruitment chains. And I believe it is the WHO who has advised groups doing RDS to make those coupons as attractive as possible, to make them seem like they have some value. And indeed, they do have a little bit of value because participants will be remunerated when they complete the survey. And so that's a key component to keeping the recruitment going, is to sort of make those coupons look a little bit valuable and enticing. And so once your seeds complete the first wave of recruitment just continues wave after wave until either the target sample size is achieved, or sometimes if recruitment is a little bit easier and has a bigger population, sometimes researchers will actually look at the convergence of the population estimates that they are trying to measure. And once those estimates have converged, then they'll stop recruitment. So I would say that's a less common stopping criteria. Normally it would be sample size. And while this is happening, you need to monitor recruitment. You may find that recruitment is actually happening a little too quickly. So you want to avoid having too many people in the early waves. Ideally, you want nice long recruitment chains. And so if you find it's snowballing too quickly, then you can pull back on the number of coupons. So it's very common to start with 3 to 5. Having done a bit of research into it, I think 3 is probably the ideal number, 2 or 3. Actually, but sometimes researchers need to add additional coupons if recruitment is stalling. And so this just goes on, and with this monitoring to make sure that recruitment's continuing, and either you're adjusting the number of coupons or you might even need to add more seeds if recruitment has really stopped. And then once you've got your sample, you have to apply these special RDS specific statistical estimators to help achieve unbiased estimates. And there are freely available software packages. So you don't need to learn any formulas. And the goal of all of this is to achieve unbiased estimates of trait prevalence in your target population. So what do you need to have for RDS? I would say the main and most important requirement is a well-connected population. So because it is a chain referral technique, if you don't have connections among people in the target population, it's going to fall apart. You're not going to be able to recruit anybody. So it's a really suitable strategy if your target population have an underlying social network. And so that might be homeless people who are connected through their connections on the street. We had a lot of success using it, recruiting urban indigenous populations. That's a well-connected group. Where it may be less successful is, I don't know, if you wanted to sample agoraphobics, people who are locked away in their houses, that it's not going to work. So the main requirement for success is a well-connected population. Obviously, you also need to have, as with any study, researchers with a good understanding of the population. And that's especially important to choose a group of seeds that represent a broad spectrum of the population and sort of give a good coverage of that underlying network. You don't want to choose seeds who are all quite similar and who are all connected to the same people. You want to ideally choose seeds who are connected to different groups in your target population. Importantly, you need some ability to determine whether the participants belong to the target population or not. So how do you do that? I know some intravenous drug user studies actually require that participants roll up their sleeves and they look for track marks. Sometimes it's enough to just ask how they know the person who recruited them, and that might give a clue. Sometimes there are questions that might be answered really only by people who are members of an underlying population, but that'll depend entirely on the population under study. And so it's important that the researchers have a very good understanding of the people who they're trying to recruit. There has to be a mechanism to trace the recruitment chain. So that's normally done with, as I say, with coupons that get handed from participants to the next wave of recruiters. And then when somebody shows up for a survey, they hand in their coupon, and you know, because it'll have a unique code, who they were recruited by. And that lets you trace those chains. A way of checking for duplicate surveys, this is tricky because when you're offering compensation for participation, you create an incentive for possibly participating more than once. And so you need to have a mechanism to try and remove those duplicate or prevent, ideally, people completing the survey more than once. I know in the Our Health Count study, they actually looked at everybody's anthropometric measurements. So they measured everybody's weight, they measured everybody's height, and that was recorded and enabled them to determine who the duplicate responses were by. And then you need some specialized software. So I use the RDS package in R. R is free. The RDS package is free. It's really, it's a nice, easy to use package. I would strongly recommend it. It's very straightforward. So RDS is great. It is definitely a step above convenience sampling, but it's not probability sampling. So we're not going to achieve the lovely, unbiased, perfectly sort of unbiased estimates that we would get if we had census data for our target populations. So some difficulties are that we have bias, maybe resulting from the initial seed choice. This one doesn't actually tend to be too much of a problem, as I'll talk about in a minute. We have non-random sampling probability. We have dependence along the recruitment chain. So there might be homophily where people who are similar are connected to people like them and they recruit people like them. And so that you can end up with a sample that might be potentially quite different from the actual population. You can have unequal activity between groups. So you might have some people, if you're, for instance, measuring the incidence or prevalence of HIV, you might find that people with the disease have a lot more connections than people without the disease. And that unequal activity can lead to some bias in the estimates. We'll have incomplete network information. We can trace the recruitment links, but what we can't do is know how else they're linked to each other. So there used to be a method that asked people to name as many as they could other people in the target population. And then the researchers would randomly sample and go out and try and recruit those people. I think a couple of those studies happened, but they haven't happened in a long time because they do not pass ethics approval. So we can't ask generally the participants how they know each other, because that would violate their privacy. And so we have this incomplete network information, and that really limits the statistical methods that we can apply to our data. And then, of course, we have inaccurate reporting of degree. So we ask people how connected they are to other people, but we don't have a way of objectively measuring that. That's always done by self-report. And so some of these can be addressed statistically, and I'll talk about that a little bit today. So the choice of seeds, there's been quite a lot of research into this, and it really does not meaningfully bias your results if, and I probably should have put this in my slide, if you have long enough recruitment chains. And so in the very first paper on respondent driven sampling, which is this is the first paper, the Heckathorn 1997 paper, it's a fairly new methodology actually. And he showed that even if the seeds were entirely belonging to one group. So let's say people with HIV, and we had no people without HIV in our group. By wave 4 or 5, the estimates tend to converge. So seed bias is really generally not a problem as long as you have enough waves in your sample. So seeds should be purposefully selected to cover a nice broad spectrum of the population. So different people connected to different people, and people who have lots of connections. So not just different connections, but you really want to try, and if you can, capture the community leaders in your seed so that they do have lots of connections and can get the ball rolling, so to speak. So this is what a typical RDS sample looks like. So each of these groups is the result of a seed. And so the seeds are colored in red. And so here you can see that this seed went on to recruit this person. And most people in this recruitment chain only recruited a single person, sometimes in another one, but that's enough to propagate a nice long chain. This seed happened to be connected to the right people. So even though this seed recruited only 2 people, the proportion of the sample that came from this one seed is actually quite high. And then you can see over here, these ones are a little bit difficult, but here we have 2 seeds. This seed only recruited 1 other person. This seed recruited 1 person who went on to recruit 1 person. So some really short recruitment chains. It's typical. This is what happens. You get normally a rather large proportion of your sample that come from just a few seeds. Okay, so I'll start to talk about some of the biases that are inherent in these chain referral sampling strategies. So this picture here is an entire network of people, and the lines are the connections between these people. So here you can see that participant B is only connected to 2 other people, whereas participant J is connected to everybody. And so if we're sampling based on a network, participant B can only join the sample if they're a C, or if participant A or participant J happen to already be in the sample and are therefore available to recruit participant B. And so there's an unequal sampling probability in our network. Participant B has a much lower chance of joining the sample, any sample, than participant J. And so this is why convenient samples are problematic. So participants F, J, and H, these pinky ones here in the middle who are well connected, they should contribute less to the prevalence calculation than participants I and B if we're trying to achieve an unbiased estimate of some underlying trait proportion in our sample, because they have a much higher probability of being chosen for any one RDS sample. Okay, so respondent degree is another piece of information that informs the statistical estimates that we conduct after the sampling is over. To control for the unequal sampling probability, we collect information about how many connections everybody has. So we ask participant B, how many other people do you know in the target population? And we ask participant J, and then we use these as survey weights to adjust our prevalence estimates. And we have to just hope that these self-reports are accurate. So asking very specific questions can help improve the accuracy. But what we do know is that the reports are not precise. So this is a survey that I did. People are really wanting to have some answers to some of these questions. So I reached out to some RDS researchers and I had a fantastic response and ended up hearing back from 53 different studies. Not that many authors, there were fewer author groups. I think there are about 20 author groups, but in total about 36,000 participants who had completed some form of RDS sample. I was able to get some data on, and this is the distribution up to just to 100. So there were actually some very large reports of reported network degree. I'm just showing counts up to 100 here, but the point that I want to make here is that when we ask people how connected they are, hopefully they're accurate, but we know they're not precise. So we see these spikes at 5, at 10, at 15 and 20 and 25. People like to respond in nice round numbers. And I think we all can know from experience that that's how we respond to questions. If somebody asks you how many friends you have, you don't say, I have 48. You'll probably say you have 50. So this doesn't necessarily mean that the reporting is inaccurate just because it's imprecise, but we do know that it's imprecise. So how do we improve degree accuracy? More recently, studies have started using nested questions. So where 10 years ago, somebody might have been asked, how many migrant workers do you know who live in the same city? Now the researchers will ask more and more and more targeted questions with the goal of determining how many people the participant could actually have been recruited by or recruited themselves. And so you would start with a broader question. How many people do you know in the city? Of those, how many have you seen in the past week? Of those people you've seen in the past week, how many have you spoken to? And so trying to eliminate this situation where people are saying that they have 1,000 connections. I know that this doesn't entirely eliminate that. We've seen some data where there were nested questions asked and we still get very, very high degree reports, and it's difficult. There's really no easy way of measuring how much this has an effect, but the recently practice has shifted to having these nested questions. And I think just on face validity, it makes a lot of sense to try and get people to think a little bit more carefully about how many people they know and to get a nice, precise, or a nice, accurate estimate of their network connections. So the prevalence estimator is the simple one from a convenience sample is simply the number of people who have the trait of interest divided by your total sample size. And so the sample proportion is great because it's easily computed, and if you have a randomized sample, it's unbiased, but it is not a good estimate of the population proportion if you haven't conducted probability sampling. So what this graph shows is the results from a simulation study. So a network was simulated, a false network, using reported degree that was actually collected in real studies, but simulating network connections. And then 1,000 respondent-driven sampling samples were drawn from that simulated network. And that simulated network I'm not looking at, I'll talk about homophily in a minute. There's no homophily. So this is sort of a little bit of a best case scenario, I guess. Here are these blue ones. And we can see what this is showing is that in sort of a best case scenario, if the underlying incidence or prevalence of your estimator is 5%, and you use the naive sample estimate, you would hope that you would, in some of those 1,000 RDS samples, you would get an estimate that was near the actual population target. And in fact, we find that the naive sample estimate is quite biased. So most of the simple naive sample proportions out of those 1,000 RDS samples are well above 5%. And so this, I'm just trying to demonstrate here why it's important to try as much as you can to mitigate the bias inherent in convenience samples. And it's because of the unequal sampling probability and things like homophily and unequal activity that we get biased estimates if we just conduct convenience samples and then use the sample prevalence. So I've talked about unequal sampling probability. Another network characteristic that causes bias is homophily. So homophily is just the tendency for birds of a feather to flock together. So we know that people tend to associate with other people of similar ages and of similar genders to them. Whether homophily is present in the sense of impacting your RDS sample estimates has to do with whether people are grouping based on the trait you want to study. So if you are studying HIV prevalence in a population, then it's how likely people of similar HIV status are to be connected to each other. So we're not talking about general demographic homophily, but the homophily that's specific to your research question. And so here on the left is a network that doesn't really have any homophily. Somebody who's a blue dot is just as likely to be connected to another blue dot as they are to be connected to a red dot. So this is a scenario where there's no homophily. If you read the literature, that would be usually homophily equals 1. This is a network of very strong homophily. So these ties here that go between the red and blue groups are what we call cross-group ties, where you're crossing between, where there are connections between different people. But most people in the network are connected to people like themselves. And so that's strong homophily. And so that might be a homophily of 5 in the literature. There are different mathematical definitions of homophily. There isn't really an agreed upon one, but this is certainly strong homophily. Normally no homophily is expressed as 1. Strong homophily values greater than 1. And then you can have heterophily, which would be values between 0 and 1. So if you have homophily in your network, then you are also probably going to have homophily in your recruitment chain, where you have people who are recruiting other people like themselves. And you can imagine that this could, if you don't control for this in your statistical analysis, that this could bias your estimates. And it does, in fact, bias your estimates. And so the advantage of the RDS is that it's not only this sampling framework, but it's also an associated set of statistics that go along with it that help to mitigate some of these network considerations that cause bias. And just the last point here, population homophily cannot be reliably estimated from RDS samples. People have tried, I have tried, it's not something that necessarily shows up in a single RDS sample, and yet it can result in bias in your estimates. So how likely you are to have homophily is probably something you're best to work out based on your knowledge of your target population. It's not really something we have the ability to estimate through statistics yet, very reliably anyhow. Okay, and the last aspect of the last sort of characteristic of the networks that can induce bias in your sample is something called differential activity. And so if I go back to this network that we looked at earlier, where we have these really connected people, if we imagine that the trait we're interested in is whether you're a circle or a square, we can see from this network that the squares are a lot more connected to people than the circles are. And so if we're conducting sampling based on the network, we're much more likely to collect these squares into our sample. And so our sample might overestimate the proportion of squares in the population because our squares are so much more connected and so much more likely to be in our final sample. And so we can imagine that maybe people with a communicable disease have elevated activity, and those go part and parcel. The more people you connected to, the greater your chance of maybe picking up COVID or a common cold or what have you. And so that's differential activity. And so they're all related. These concepts of unequal sampling probability, homophily, differential activity, they're all related, but they are sort of little distinct topics. Okay, so just to recap, the RDS sample characteristics that are going to impact your sample are the network degree, so how many connections people have. So we want to, as much as we can, try and get an accurate assessment of how connected people are. The homophily, so how much people stick to other people like them, and the differential activity, how much your trait influences your network connections. And so these are all the things that the RDS estimators help to sort of fix, help to control for.
Lisa, you at the beginning, you gave me permission to jump in and ask.
Yes, please do.
So I'm going to take you up on that because we have a lot of questions about the previous slide.
Oh, okay. This
one? Where you list the one where you list the three.
Oh,
that
okay.
one. Yeah, right there. Okay. The biggest question is about homophily, because that is a very interesting idea that I think is new to many people who aren't previously involved in RDS sample characteristics. And so we might need one more very concrete example of homophily, because there's a little bit of confusion. Questions like, if there is, and I don't want to imply that people asking the questions are confused, but
this is a lot to take in.
Isn't a homophily, the fact that there is homophily, isn't that why RDS sampling works? And if there isn't homophily, don't you have a problem in your theory that you have a community that you're sampling from? Is kind of one of the common questions.
Oh, okay.
Can you help us get some clarity around that?
Yeah, so that's a great question. Okay, so I'm going to use this network here to talk about it. So RDS works because of these connections that exist.
Right.
Now, if actually, I'm going to go back to I lied. I'm going to go back to this one.
No worries.
So it works because these connections exist. Now, if you have a population with very strong homophily, where people, so if we have two groups, and so I'm going to use the red and blue group. You've got red and blue. You want to estimate the proportion of reds in your population.
Okay, so I'm going to pause just to make sure everybody can kind of stay on the homophily train. So what we're trying to understand through our sampling activity is what's the proportion of people in our population that are red?
Yes. Okay. So red could be, maybe it's people with HIV. Maybe it's
let's stick with that.
And so if we have very strong homophily, and there aren't a lot of connections between the people with and the people without, then it makes it less likely that we're going to hit on one of these people here who have these cross-group ties.
Right.
Because there aren't very many of them. Whereas in this scenario, here, who you're connected to doesn't depend on your HIV status. You're just as likely to be connected to somebody who doesn't have HIV as somebody who does have HIV. And so this sample, if we were to just use, say, the sample proportion, just the simple sample proportion, a sample coming from this population is going to be less biased than a sample coming from this population. So the homophily creates bias. So what we need for RDS to work is the connections in the first place. We need people. So if our underlying,
it's very interesting.
If our underlying population is, say, like drug users, we want the drug users to be connected. And ideally, we don't necessarily want them to just hang out with people who share their HIV status. We want them to be connected regardless.
That's very interesting. I think that is what's coming up a lot in the chat, which is like, it sounds kind of like RDS is trying to take advantage of the fact that birds of a feather flock together, but not too much.
So, well, right. So, so RDS takes advantage of the connections,
right,
for the sampling, and then the RDS statistics help to correct for this situation.
I see. And by RDS statistics,
I'm coming to that.
Do you mean, I'm good, but I'm just going to ask kind of up front so that people don't fall off the homophily train. RDS statistics is what we're going to cover in a second. Those are the things that help adjust your estimates for this exact. So by estimates, we mean adjust the results that are going to come out of this research project that say, among this community of intravenous drug users, this is the prevalence that we think are HIV positive. Yeah. Yes,
that's right. Fabulous. So you'll get a different estimate. Okay. All right. I'll go back. Where were we? We were. Okay. So, right. So we want to help account for the fact that we might have differential activity. So we might have our HIV positive people might be more connected than our HIV negative people. And they may be more connected to each other. And so RDS statistics help us. So this is a little bit of an ugly formula. That's okay. What this is this is the original RDS estimator. These Ds are just the average degree. So when you say, how many people do you know who are intravenous drug users? This is just the average degree for, say, the people who are HIV positive, and the DA would be the average degree for the people who are negative. And then these Cs, the reason I'm showing this to you is just to help you understand that the first RDS estimator takes into account the degree, but it also takes into account the ties between the groups. So in that homophily slide that we were just talking about, these are the number of connections between people in group A and group B. So we're ignoring the connections that are just among group A and B, but we're looking at the number of connections that go between the two groups, between people who have HIV and people who don't have HIV. And so this is the original RDS estimator, and it accounts for both things. It accounts for cross-group ties, so that helps to correct for both homophily and also elevated degree activity. And it takes into account the average degree, which helps us correct for the unequal sampling probability. Another estimator that was developed shortly after that is called the RDS2 estimator, and it does not look at cross-group ties. It just looks at how likely you were to be included in the sample based on how many people you're connected to in the population. And it is still remarkably effective. The RDS1 and RDS2 often give similar estimates, and that is because you really need a very, very strong degree of homophily before it matters more than the number of network connections, basically. So those are the two main estimators. There are a couple of other ones I'm just sort of mentioning here so that you've heard the terms, the successive sampling estimator and the homophily configuration graph. They're basically adjustments to the estimators I just showed you, but they were designed to work a little bit better when your sample is a large proportion of your population. So that might happen if you have a very tiny population. It's probably not the common case, though, I would say. And then the RDS package in R is great. It can do all of these estimators. It can do bottleneck plots and convergence plots. I know I haven't talked about those yet, but and I'm not going to in this talk. But the RDS package has lots of great utilities for analyzing RDS data. And that's it. I think
that is fabulous.
So questions.
Yes, there are many, many questions. This was so helpful. Thank you so much for Lisa taking time out of your schedule to help us understand kind of the practical and the nitty-gritty aspects of another way to gather sample data about people. This is really, really useful ideas and could go a long way towards generating equitable evidence for hard to reach populations. We have so many questions. I am going to start with some of them that were asked repeatedly by a number of people. And if you're in the room and you want to unmute yourself and ask your question, just raise your hand in the Zoom menu, and we'll see who we can get to. I think the most common question, well, there's several. I think one of the most common ones is totally get the need to kind of check network connections and do something like measure somebody's height to make sure that they're not being duplicated. Do you know if there's research on whether that biases the really hard to reach populations, because that means that the people who get into an RDS sample are willing to provide that level of personal information?
So I would say that study is the exception to the rule. Most studies do not gather that kind of personal information. So that was done on it was a health study collecting baseline health information about urban Indigenous people. The study was conducted by an Indigenous research group. So there was I would say a lot more trust than maybe is generally seen between researchers and those that they are researching. And the community wanted this data. And so there was a lot of buy-in, but you're right, that is the exception to the rule. It is, I've been on many calls trying to decide how to reduce duplicates. It's not easy. And sometimes it comes down to the research assistant recognizing people, that can be quite useful. I know it sounds sort of like a simple, not very scientific method, but it works.
Yeah. And I'm so delighted to hear your answer to that question, because your answer to that question illustrates just how important equity is. I mean, if you've done the work to ensure that the people you're asking to submit data are interested and invested and feel value in the actual question, you're going to be able to collect better data, whether it's probabilistic, RDS, like it's so like data quality and data response problems are almost always equity problems. They're power problems.
Yes.
So I'm so delighted to hear the answer to that. Okay. A lot of people wanted to know, why is it a problem for the sample to grow too fast?
So I guess it is and it isn't. If you are recruiting to a fixed sample size, and your sample grows too quickly, then you're not going to have long recruitment chains. You're going to have short, fat ones. And maybe that isn't a problem, but definitely the longer the recruitment chain, the less the seed bias is. So the further you can sort of get from your seeds, the more confident you can be that you're actually getting a representative estimate. So when you look at convergence plots from RDS studies, you can see that if we're trying to measure HIV prevalence, it might go up and down, and it might be pretty hairy for the first 4 waves, and then it settles nicely. And so by sort of restricting the number of coupons to 2 or 3, then you're forcing people to be one more step removed from the seed. So we've probably all done the 6 degrees of Kevin Spacey sort of thing, where you sort of want to be the 6th degree. You don't want to be the 2nd degree.
Okay. Yeah. Thank you so much. That makes perfect sense. And I think we need to wrap up. I think we have time for one more question, because we try and end at 5 minutes to 1 so that everybody doesn't have back-to-back meetings. So the last question I'm going to ask is something that a lot of people are starting to put into the chat right now. Does this work only for in-person data collection? Have you seen this ever work for online data collection?
It does work for online data collection.
It does.
The Empower study used it. And so just like you can pass around nice, colorful coupons, you can send digital coupons. And so you can send, they can have unique codes that allow them to access a survey. It is a little bit more difficult, I would say, maybe to monitor the duplicates, but there are ways to see if all of the responses are coming from the same IP address, and that sort of thing. So certainly it has been done.
Okay, that is very, very good news. We will leave it there for today. I know this is not only is this my favorite hour of the week, it is my fastest hour of the week. I cannot believe we're done. If you have more questions and you want to share the recording, we are absolutely going to put the recording along with a whole bunch of the resources that were mentioned, and also some resources that we promised to share with you in the chat. We will put them all there at the link that I just put in the chat, which is our Talking Data Equity Community Forum. Lisa, I cannot emphasize how helpful and how exactly on time this presentation was for some of the really important projects that our community is working on. So thank you so much for taking the time. And we are meeting same time, same Zoom link next Friday. There's no guest speaker, so I'll be the facilitator, and I'll be doing a presentation and taking lots of your questions that you've already submitted about how do you kind of report results that say, that might get at differences or disparities between groups without always automatically centering the dominant group or automatically centering the privileged group. Should we look at things in terms of gaps? Should we not? How do we decide? So we're going to be tackling all those questions next week. And if you have specific examples that you want us to talk about, you can always put them in the forum, and we'll prepare some slides and some possible solutions, and we'll share them with you next Friday. So thank you all, amazing community who continues to prove Zoom wrong, that you can have several hundred people in a Zoom meeting and not get trolls every Friday. I am so proud of us. And this has been a fabulous event. Thank you, community. Thank you, Lisa. And I'm going to stop the Zoom meeting, and everybody have a fabulous rest of your day. Bye, everybody.